Hello guys, in this video we are going to know about everything about the anatomy of the larynx. Okay, first before going to anatomy, let's see about the embryology of larynx. Okay, when we see the embryology, this larynx is formed by the fusion of both fourth and sixth brachial arches. Okay, then this blood supply of this fourth arch is derived from the right subclavian artery arch of aorta. Okay, on the right side, fourth arch, and this is fourth arch right, fourth arch right, fourth arch left, sixth arch right, sixth arch left. Okay, this is supplied by the this fourth arch right is supplied by the subclavian, where this is supplied by the arch of aorta. Then this is supplied by the right pulmonary artery. This is ductus arteriosus. You can draw a diagram here, like here have heart here, having the arch of aorta here, having the branch here, and having the right pulmonary artery here. Okay, that's it. Then when we see about the nerve supply, it's superior laryngeal nerve for the fourth arch and recurrent for the sixth arch. Superior goes for 4 above. Okay, then this recurrent laryngeal nerve supplies all the muscles except this cricothyroid. Okay, where this cricothyroid is supplied by the external laryngeal nerve. Then muscles we can, when we see this fourth arch, all constrictor muscles of pharynx except cricopharyngeus in pharynx. This fourth arch forms muscles of pharynx. Okay, sixth arch forms the muscles of larynx. It forms all muscles except cricothyroid. Okay, then let's see about the cartilages. This fourth arch you can know by the mimic cuneiform, thyroid, and epiglottis, where this epiglottis only the elastic cartilage, where the others are the hyaline cartilages. Then this sixth arch cocaine, this corniculate, cricoid, and artenoid. Okay, then when we came to see the cartilage of larynx. Okay, before we seeing this cartilage and muscles, let's see about the simple handwritten notes. Okay, see, these cartilages are totally 9, where 3 is paired and 3 unpaired. Okay, first see about the unpaired versus thyroid is the largest cartilage. You can see the structure. This is the anterior most part, forms the laryngeal prominence or Adam's apple that can you feel in your neck. Then it has a superior horn, inferior horn on the posterior side. Okay, this fold is known as the I tell this in later. Okay, this thyroid is attached to the hyoid bone above by the thyrohyoid membrane. It connects hyoid bone to the superior thyroid cartilage. This fold is median or epiglottic fold. Okay, then see, these are the overall structure. This is thyroid, this is the artenoid. These both are like inverted shape, but thyroid is a bit larger than the cricoid. This one is the artenoid. Okay, then when we see about the cricoid, it is signet-ring raped cartilage. See, this is a complete ring. It doesn't interfere in anywhere, whereas this thyroid in the posterior it has interruptions. Okay, then this cricoid is attached to the artenoid above on both sides. Then it attaches to the trachea by cricotracheal membrane. Okay, these three are hyaline cartilages. Okay, then we can also include what is that, corniculate also. Okay, no matter. Then artenoid cartilage, it is the only cartilage which is paired. We can use both artenoid cartilage attached inferiorly with the cricoid and superiorly with the corniculate. Okay, next we come to the elastic cartilages. First is the epiglottic cartilage. It closes the laryngeal ends. It's closely attached to the base of tongue. You can see this is the base of tongue, means this closes like this. If a food bolus is coming, okay, then this space between this base of tongue and epiglottis we can divide it into three. This is the median epiglottic fold, and both lateral epiglottic fold. This is the lateral, this is the median. Okay, then this space is known as vallicula. Okay, vallicula, on both sides vallicula is there. Then this epiglottis, before epiglottis you can see this is the hyoid bone and this is the epiglottis. This space is known as pre-epiglottic phase. Okay, pre-epiglottic space. Before anterior as hyoid bone and posterior as the elastic cartilage. That's very important about this elastic cartilage. Then when we come to the cornicate cartilage, it sits on the apex of the arytenoid cartilage. It appears as nodule on aryepiglottic fold. Okay, as I said, no, on aryepiglottic fold it appears as nodule. Okay, then cuneiform cartilage, it's a paired cartilage. Okay, it's also appear on the aryepiglottic fold. Okay, then let's come to the membranes and ligaments. Okay, there are nine major ligaments and membranes. Okay, first let's see about the you can call it as ligament or membrane or okay. Then first ligament, the extrinsic membrane ligaments. Okay, extrinsic membranes, and there will be intrinsic muscles, they will be there. Okay, extrinsically it's muscles and intrinsically it's membrane. Extrinsically it's membranes and intrinsically it's muscles. Okay, now first thyroid membrane, it attaches the hyoid bone with the thyroid. You can see it is represented in the pink. Then lateral thyroid membrane, you can see represented in the blue color in the lateral side. Then median thyroid ligament, this is median thyroid ligament. Then there is median cricothyroid ligament. Okay, you can see this here, median cricothyroid ligament. Then cricotracheal ligament, you can see between the cricothyroid and the tracheal. Then intrinsic membrane ligaments, first is the conus elasticus, from inner surface of cricothyroid to vocal fold. Okay, from inner surface of cricoid to vocal fold right here. Okay, this is conus elasticus. Then vocal ligament, it encloses the vocal fold. When this is the vocal fold, it encloses this vocal fold, it's a vocal ligament. Then quadrangular membrane. Okay, this attaches the epiglottis to the arytenoid. It is a very important membrane which forms the false vocal cord. Okay, it has a clinical importance. Then vestibular ligament is present here, covering the vocal fold. Okay, then intrinsic muscle, there are 7 muscles of larynx like cricothyroid, thyroarytenoid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, and vocalis. Let's see about the functions of each of these muscles. First we will see about the cricoarytenoid muscle. Okay, this is the anterior most muscle. Okay, you can see it arises from here and attaches to this thyroid, from cricoid to thyroid. This is the only muscle which causes tension of the vocal cord. I can explain this later. Okay, first it arch of cricoid to lamina of thyroid, inferior thyroid horn. It increases tension on vocal cord. Okay, it is the only muscle that is supplied by the external laryngeal nerve. Okay, see about the nerve supply of larynx. It is supplied by two nerves, superior laryngeal nerve and external laryngeal nerve. This supplies the cricothyroid. This gives branches recurrent laryngeal nerve, right and left branches. These two supplies all muscles of the larynx. Okay, then see when this muscle contracts, this pulls this arytenoid towards this side, and it increases the length of the vocal cord. See, this is the vocal cord. When this is stretched here, the length will be increased, so this causes tension of the vocal fold. Next, thyroarytenoid muscles attaches from thyroid to arytenoid. Okay, from thyroid to arytenoid cartilage. Okay, it reduces tension on the vocal fold, that is, it causes relaxer of the vocal cord. Then let's see the thyroadenine muscle. You can see here from the thyroid cartilage till the adenoid cartilage. When it contracts, the muscle becomes bulk, broad and thick, so it causes relaxation of the vocal cords. Similarly, like the vocalis muscle has the same function of relaxation of vocal cord. Okay, then when we see this posterior cricoarytenoid muscle, you see this is the posterior most muscle. It's a large bulk there. When it contracts, it open the larynx. So anything going away is known as abduction. So it causes abduction. The only abductor of the larynx. So it is also known as life-saving muscle when the airway is obstructed. Then when you see about the lateral cricoarytenoid muscle present here, when it contracts, it closes the rotation of the larynx, so it causes adduction. Then everything muscle causes adduction only. Okay, adduction on this transverse adenoid, everything closes this space and causes adduction. That's all about the muscles. See, epiglottis elastic, adult leaf shaped, children omega shaped. It has a very important significant where it is known as laryngomalacia. Okay, it's a congenital condition, omega shaped. Then this thyroid cartilage is in the shape of V with the right and left lamina both meet at C3 to C4. Okay, it's very important. C3-4 in males it is in 90-degree angle, and in females it is 120-degree angle, the prominence. Then the cricoid cartilage, it is combined by the root trachea with the help of cricotracheal ligament. Okay, it is the only cartilage forming a complete ring. You can see here, this is the cricoid, the complete ring. Then arytenoid cartilage has more important process. Two important vocal process and muscular process. This vocal process is the part forms the posterior method of vocal cord, and the muscular process forms it gives attachment to the intrinsic muscles. See, this is the vocal and this is the muscular process, two process there. Then corniculate cartilage of Sontonori, this is the fibroelastic in nature. Corniculate you can see here. Then the cuneiform can be seen on the aryepiglottic fold. Okay, that's another aryepiglottic fold. Intrinsic muscle extension we have seen there, thyrohyoid ligament. Then the cricotracheal extrinsic, the intrinsic ligaments you seen, cricothyroid ligament, the cricothyroid muscle. Okay, then it's very important to see about the pre-epiglottic, as I said earlier, between the hyoid bone and this epiglottis, this space known as pre-epiglottic space, where there will be fat accumulation. Okay, then this upper superior border is formed by the hyoepiglottic ligament. Then posterior is formed by the epiglottis. Then anterior part formed by the body of hyoid, then thyroid ligament, then a small part of thyroid cartilage too. Okay, then it's fat filled. It's a potential space where malignancy can be spreaded. Then epiglottis is divided into two parts like suprahyoid epiglottis and infrahyoid epiglottis, depending upon the epiglottis level. Okay, depending upon the hyoid bone of epiglottis. Then laryngeal inlet is the, you can see laryngeal inlet here. It's the laryngeal inlet. Behind this is the esophagus. Okay, this is the epiglottis. This is the guana. This is the soft palate. This is the oral cavity. You can see ula. This is the aryepiglottic fold. Okay, then see Laryngeal inlet, anterior epiglottis, posterior retinoids, retinal fold is between part of larynx that contain vocal fold is the part of larynx that contain vocal fold is known as glottis. Okay, this is the glottis, and the part above this is known as supraglottis, and the part below is known as subglottis. Okay, that's it. Then this is a small cross-sectional diagram of the larynx. You can see here. Well, this is the vocal cord surrounded by vocal ligament and membrane. This is the true vocal cord. Then this is the false vocal cord formed by the quadrangular membrane. It may, when you see from the above, it appears as a vocal fold. Okay, the space between this false and true vocal cord this is known as ventricle. Okay, this is a true space. Then this is the epiglottis, this is the laryngeal inlet, this is the last cornicate cuneiform cartilage joining, this is the okay, this is what epiglottic fold. Then that's it. Okay, you can see it everything clearly. This is the hyoid, this is the thyroid membrane, this is the thyroid cartilage, then three parts, glottis, supraglottis and subglottis. You can see the vocal fold, ventricle, false vocal cord, cricoid, down here, then epiglottic fold, this one, then everything the same. Okay, let's go into next. This is the false vocal cord or ventricular fold is formed by basement membrane and mucosa. This basement membrane is nothing but the quadrangular membrane. Okay, in glass blowers, weightlifters and temple players, increasingly the pressure will be on this false ventricle. And the ventricle, that is a true space. Okay, so the pressure starts increasing the size of the ventricle, so it causes laryngeal. It may be internally or externally. Okay, if it externally, you need to do the external surgery, or internally you can do the surgery internally. Okay, cyclitic swelling. Then it's a laryngeal. It's a air-filled cystic swelling in neck. Okay, it arises from the anterior most part of ventricle known as saccule. Okay, anterior most part of ventricle. This IUD present here. Okay, it's a laryngeal. Then produces sign known as Bryce sign. Compressing the size, swelling decreases with the gurgling of sound escape. Gurgling. Okay, it's very important. External, this is known as Bryce sign. Then internal, if it was internal, then foreign body sensation, there will be a foreign body sensation in throat, cough and noise. Okay, then on examination you can see smooth swelling of vestibular fold and epiglottic fold. You can see the swelling. Okay, then if you want to take CT scan, you should do in a valsalva procedure. Okay, due to the increased pressure, the more laryngeal you can see the space is a lot larger or less. Okay, then surgery is external is surgical excision, whereas internal transoral microlaryngeal, as I said, through the mouth. Okay, then combined, if it has both, means you should go for surgical excision, where you can correct this also. When you corrected this, you can correct this next one. Okay, then when you come to the glottis region, it has two vocal folds. Okay, facing opposite of each other. Then they are named as true vocal fold, or they are lined by non-connecting stratum epithelium, whereas other part of larynx is lined by pseudocytopenic column epithelium. Okay, this vocal fold is formed by five layers. First is the non-keratinizing stratified squamous epithelium, then lamina propria containing superficial, intermediate and deep layers. Okay, deep, superficial and intermediate layers, where this then the vocalis muscle, here the vocalis muscle. Then there is the superficial lamina propria is also known as Reinke space. Okay, where any high pressure or any condition in smokers especially, it causes Reinke's edema. Okay, so it if it's edematous, then it will close this vocal fold and there will be difficulty in breathing. Okay, then the narrowest part of larynx in child is subglottis. Okay, due to undeveloped tracheal rings, whereas narrow spot of larynx in adults is glottis. Okay, then when you don't want to do the examination of larynx, you can go for a direct laryngoscopy or indirect laryngoscopy. This indirect laryngoscopy is only done by a general anesthetist. Okay, it require a OT. See, we can see the actual larynx as it is. Then phonation is not possible. Okay, then when we see about what is phonation, it is the sound coming. We can check the sound how it's come. Okay, whereas in that you can check by telling the patient to do that. Then patient cooperation is not required here. Then additional biopsy can be done. Then hidden areas can be seen. The hidden areas are ventricle, subglottis, anterior commissure, laryngeal surface epiglottis, then posterior cricoid area. Then in that laryngoscope, it's a done in easy procedure. It's done in OPD. Okay, then patient cooperation required. Then biopsy cannot taken, whereas hidden areas cannot be seen. Then when this is the structure seen in direct laryngoscope, we can see the epiglottis here. Then when it's the image formed is virtual and erect. Okay, inverted image you can see. You can see the epiglottis, you can see the vestibular fold, you can see the vocal fold. This vocal fold you can see as a white fold because of the squamous epithelium. Then you can see the posterior commissure. This is the anterior commissure. This one is the posterior. This is the anterior commissure. Then this is the piriform fossa between the this aryepiglottic fold and the thyroid. You can say yes. Then okay, then when it comes to this is also same epiglottis, anterior commissure, vestibular fold, vocal fold, piriform fossa, posterior commissure. Okay, then we can touch the voice quickly. Subglottis is contains of ring of cricoid cartilage. Is only pathology when there's a large mass obstructing airway. It produces stridor. Okay, then paraglottic space of Tucker is it's a very important space. You can see a paraglottic space of Tucker. It lies, you can see the boundaries. Anteriorly it is thyroid cartilage, then superiorly is the quadrangular membrane and vestibular fold. You can see this fold. Then inferiorly this is the conus elasticus, and then posteriorly it is the piriform fossa. So this both the spaces, paraglottic and piriform fossa are close contact with each other. Okay, this is piriform is also contacting with anteriorly with the pre-epiglottic space. So these three spaces are in contact with each other. Okay, so you can see this is the what space? What paraglottic space of Tucker. Okay, then see if the present in anterior is pre-epiglottic, if it's present laterally this is paraglottic, if it's present posterior it's known as piriform fossa. Okay, that's it. Okay, any malignancy can spread to pre-epiglottic space and okay, then nerve supply when we see normally it's vagus nerve. Superior laryngeal nerve gives two branches, external laryngeal nerve and internal laryngeal nerve. This external laryngeal nerve supplies this cricothyroid, the internal laryngeal nerve supplies the supraglottic, the recurrent laryngeal nerve supplies all muscles of interosseous muscles. The above I said nerve supply is wrong, please don't mistake there. This is the correct one. Superior laryngeal nerve and recurrent laryngeal nerve is the two nerve supply. Okay, recurrent laryngeal nerve gives right and left branch. Right supplies right takes turn from the subclavian artery, whereas the left takes turn from the ductus arteriosum. So it come to superficial. So injury during thyroid surgery, whereas this ductus arteriosum due to this left one is deep injury during cardiothoracic surgery. You can see the diagram here. The right one came from the right subclavian, whereas this left one takes turn from the arch of aorta due to the ligamentum arteriosum. Then any level of At level of glottis, the right and left, both anastomosis and give Gallen's anastomosis supply the glottis. Then when we say about the functions of the larynx, main function is the protection of airways, the first most important. Next is the sound protection. Okay. Then we have seen already we have seen this subductor adductor tensor. Okay. Then we need to study motor condition as phonesthesia. This is what condition is known as phonation. Okay. Then phonesthesia is known as vocal fatigue. The muscles became fatigued. This interarytenoid muscle became muscles can be fatigued, thyroarytenoid and interarytenoid. If this thyroarytenoid muscle became fatigued, okay, then this muscle can contract, so there's a large space here. This is known as spindle shaped gap. If this thyroid carotenoids became fatigued, they can't contract, and it produces a triangular gap. Both as are fatigued, they causes keyhole appearance. Okay, the treatment is voice rest and speech therapy. Thank you very much.